Good morning, everyone. My name is Rod Escayola, and I'm a condo lawyer with Gowling WLG. I'm also the editor of the Condo Advisor blog. And I'd like to welcome everybody to this very first webinar on the coronavirus pandemic and its impact on condominiums. Now, we're envisioning this to be the first of a series of webinars, which for now, we are planning on holding on a weekly basis or as required, same time, same channel, same people. And I mean, the situation is fluid, it's evolving, and so we'll see how it goes, but there's clearly a need for information. And I say this mainly because of the massive response we've had to our invitation. And that's why we had to split you in two, because there were too many that could be accommodated at once. So what we've done here as a result, or to respond to this epidemic crisis, what we've done is we've struck together an industry-wide crisis prevention cell. And I've invited a couple of experts out there, and we'll invite some more as required. And I've invited them to try to sort of get together and put some information for everybody to be able to sort of navigate through these difficult times. And so I'm going to start by introducing maybe the members of this crisis prevention cell. And I'll call your name and I'll ask you to introduce yourself with a sentence or less. So we have Denise Lash.
Thank you, Rod. My name is Denise Lash. I'm the founder of Lash Condo Law, and I'm here also representing CAI Canada.
Okay, thank you. Sandy Folds.
Hi, I'm Sandy Folds, the Executive Director of the Hamilton office of Wilson Blanchard Management, and I'm also the current Vice President of the Golden Horseshoe chapter of CCI.
Okay, and if I could ask Catherine to introduce herself.
Good evening, everybody. Catherine Gao. I am a career condominium manager proudly in RCM, and I'm representing the Association of Condominium Managers of Ontario tonight.
Okay, and Jason Reed, please.
Good evening, everybody. My name is Jason Reed. I'm the Senior Advisor for a consulting firm, National Life Safety Group. I have significant experience in business continuity, applying it to critical infrastructure, and I look forward to speaking with you today.
Thank you, Jason. Graham McPherson.
Hi there. My name is Graham McPherson. I'm an associate with the Condominium Law Group at Gowling WLG.
And finally, David Plotkin.
Hi, everyone. Also, David Plotkin, an associate at Gowling WLG. Are you able to hear me, guys?
Yeah, we hear you for sure. Okay, well, thanks everybody. I'd like to thank the people you've just heard. I'd like to thank you all for jumping in on such short notice and accepting to share your knowledge. I mean, we're sort of figuring things out, all of us collectively, as things evolve. And as I said, online today we'll have up to 500 registration, and so right now we have 180 on the line. Now, with so many participants, you have to understand that we will simply not be able to answer every question. We will not be able to tackle every issue. And so this is going to be today a 30,000 feet bird's view of the situation. We're going to try our very best to tackle the more urgent, the more important, the more pressing issues. But by no means can this replace you seeking advice from your advisors, be it a lawyer, your manager, your security provider. And so we're going to provide as much information as we can, but you have to keep in mind that every situation varies. It's different. It's a fact-specific case for each one of you. And whatever we're unable to do today, we hope to do it next week. Now, I would ask you not to turn your microphones on and not to turn your cameras on necessarily, because, I mean, people will see you. The microphone we've muted, but I mean, if your camera's on, we can see you and we can see what you're wearing. So hopefully you put on your best Sunday dress. Now there's a chat function for those of you who are familiar enough and those of you who want to use it. Graham is going to be trying to sort of monitor the chat function, but I really urge you to sort of focus on the presentation more so than on chatting or more so than sending an email, because we may not get to it, but it's up to you. So Graham is going to try to monitor this as we go. Now, there it is. We've covered that. So let's dive in, if I may. Now, I won't spend much time describing the situation that got us all reunited today. I mean, everybody's watching the news, and unless you've lived under a rock, you know what's sort of unfolding. But suffice it to say that on March 8th, the World Health Organization has declared the coronavirus a global pandemic. Yesterday in Ontario, our premier declared a state of emergency, and as a result of that, the province is prohibiting gatherings of more than 50 people, closing indoor recreational centers, theaters, concert venues, place of worship, schools, daycare, and so on and so forth. And many provinces have followed suit. Some of them were ahead, actually, of Ontario, such as Quebec. Now you have employers that are sending people home. You have employers that are asking staff to work remotely. And so with all of this, what's the purpose of that, and it is quite required, the purpose of that social distancing is to sort of try to flatten the curve, as everybody sort of refers to. Now, the issue may be this. The social distancing that's being imposed on the public space is pushing everybody back home. In the case of condominiums, there's 12,000 condominiums in Ontario, give or take. There's 1.5 million Ontarians that are living pretty much on this space of a postage stamp, one on top of each other. So that public distancing that we're putting on public spaces may be potentially compromised on the condo side. And what I mean by that, I mean, what's the point of closing a gym, a public gym, if you're going to have your fitness room continue to provide services to 500 occupants or so? So that's the purpose of today's conversation, not to cause panic, not to create panic. Don't do what I'm just doing. I'm just licking my fingers to push my fingers. Don't do that. And so the objective is not to create panic. The objective is to try to help condo corps to deploy reasonable measures that will help our 12,000 communities. Okay, Graham, do you want to sort of share quickly some of the stats that we've gathered? Let me put the stats on, and if you can share those, talk about that a bit.
Yeah, happy to. So as you'll see, we've collected some statistics through the Condo Advisor website that I'm just going to briefly take us through. And if you don't have it, we can make this presentation available. But what we're seeing in general are that for the most part, looking at about 80%, people are concerned, either somewhat or very concerned about the spread of COVID-19 in the complexes that they live in. And in turn, not surprisingly, people are also of the view that, I assume my neighbors share my concern. Here's where we get one of our most resounding responses to the question of, do you think your condo corporation should be taking precautions with respect to the spread of this virus? And the answer is a resounding yes. When it comes to what people are aware of in terms of who's been infected in their complexes, for the most part, it appears that we have another resounding answer here that people are not aware of any infection cases in their complex. Now, that does not necessarily mean there are none, but it does mean that, either there are few or what there are currently undiscovered. In terms of what precautions different corporations have taken to deal with this.
Actually, Graham, if you don't mind, we'll park that.
Okay.
And we'll get back to this when we talk about what kind of precautions managers can take. So I'll just park that for a second. Thanks so much. Very good. And so what we're going to do, we're following an agenda. Hopefully some of you have printed that. And so we're going to dive in now in the legal section, and I promise to keep it short because really what you need is practical advice, mainly from your managers. And we have two managers extraordinaires on the line. And so we don't want to keep them quiet for too long. But let's just talk about the legal risks. And Denise, I wonder if you can maybe start by talking about disclosure obligations.
Okay, so that's what I want to talk about. I want to discuss owner's disclosure, visitor disclosure, and what steps the corporation should take with respect to those two items. And I want to emphasize firstly that condominium corporations are not medical facilities, and boards and managers should be careful in assuming the role of a health provider. This is a really difficult issue, and Jason Reed, who's on this webinar, and I've had these discussions. We know that we're in uncharted waters, so there's a lot of things that we don't know. And for now, what's important is that we take guidance from our public health officials and the different levels of government. So let's get into the disclosure requirements as to an obligation for an owner or a resident to disclose whether they've been recently traveled on a plane, or whether they're in self-isolation, or whether they've tested positive for COVID-19. You cannot force a resident or an owner to disclose that information to management or the board as to any physical condition or whether they've traveled abroad. Even if that information was made available to the corporation, you cannot prohibit a resident from coming into the building, or who've traveled and you think that they may be susceptible, to enter the building and go into their unit. They have a right to enter into the building. Unless there is some kind of government directive that as a corporation you cannot prevent residents and owners from coming into the building. So what should corporations do? We're recommending that you notify residents that if they have tested positive for COVID-19, that they should advise management on a confidential basis by phone or email. And this would only be for the purpose of assisting the resident, for example, with deliveries to their unit. Management and the corporation should be careful not to take on any other role, not as a health provider or health advice, but only with respect to that limited role. You should not notify residents that a resident has been diagnosed with coronavirus unless you are able to reasonably confirm the diagnosis is true from the resident directly, or from a co-occupant living with them, or from the public health official who has notified the board or management of such diagnosis. In no circumstances should you rely on rumors or unofficial sources. When you disclose to the residents, you should not disclose any information about where the resident is located or who the individual is, not even to the board members. So management gets this information. It's for management only for the purposes that I mentioned. This is private and confidential information. Now, there may be reason why security, who has to make a delivery to the unit outside the unit, may need to know that they have to do so outside the unit, but you don't have to give them any information. The corporation should also notify residents that if they've traveled abroad, that they should follow public health guidelines for self-isolating for 2 weeks. I would not recommend the corporation request that those individuals advise management that they are in self-isolation. Management cannot be expected to monitor all the units that have been self-isolated, nor does the corporation want to assume that responsibility. This is a public health issue where directives will come from the government as things progress. Now, in terms of visitors, corporations should not be screening visitors at this point in time. And I say at this point in time because there may be a point in time in which it is important to take further action. As of today, that's what we're recommending. Remember, we're not in a shutdown situation now. There's no government directive on this. Visitors also have no obligation to disclose this information on entry. And if they refuse, what should management do? Is it management's role to escort them out, to not let them in? What we're recommending is that signage be placed at the front desk and notification be sent to residents about their obligation to ensure that if visitors are entering onto the property, that they follow the protocols established by public health.
Okay, wonderful, Denise, or bang on time-wise, because that's going to be our biggest challenge today, is to make sure that we stick to our time. So that's great. Well done. Thank you. And so let me add to this along the lines of condos obligations and why we're talking about all of that, because obviously we're sort of a hybrid between a private space and a public space. Under the Condominium Act, condo corporations are mandated to manage and control the common elements. Now, for people to get to their units, they have to go through common elements. Now, our duties, the condo's duties and the corporation's duties and the board's duties are to manage the assets and the common elements, not to manage individuals, and certainly not to manage a health public crisis or a pandemic. Your job is really to manage the common elements. Now, having said that, to go to the units, as I said, you need to go through the common elements. And so one of the challenges that we face is that within our duty to manage the common elements, We also have a duty to take reasonable precautions to ensure the reasonable safety of those individuals accessing the premises. That's under the Occupiers Liability Act in Ontario. And so that means that we need to take these precautions, these steps, to ensure that pretty much anybody that will set foot on common elements, in the elevators, in the lobbies, will be somewhat protected. But I mean, how can we do this in light of the current situation, and especially in light of a situation where we don't control where people have gone and who has traveled and who has washed their hands and so on and so forth. So in light of that, you have to take, in our view, and that's our recommendation, you have to take some reasonable steps. Some of the reasonable steps could include communicating with the owners. Because the way I see it is this: if there was a flare-up in a building, and if in fact suddenly everybody on the 9th to the 12th floor got contaminated, a question could be asked of the corporation, well, what have you done? And if the answer is no, nothing, it's not our job, you're placing yourself at risk. And so communicating to the owners a certain level of precautions is what we recommend. Putting hand sanitizers and close to the lobby, close to the elevator, and so on and so forth. Shutting some of the common amenities, shutting down the gym, shutting down some of these amenities, which are common elements where people would congregate otherwise. Those are all steps that you can easily take, which would improve the level of safety for everybody else that is involved. And we're going to talk about this in detail a bit more as we move along. But those are the kind of precautions that we have in mind and that we recommend at this stage to sort of ensure, as much as feasible, a certain level of general safety. And of course, the key one is you have to increase your cleaning and disinfecting protocols. You have to. Now, we won't be able to clean the elevator call button every time somebody presses on it, but you certainly should be doing your due diligence, and you should really work harder than you would normally at keeping all of these areas clean: the hallways, the doorknobs, the door handles, the elevator, the call button, the garbage chutes, and so on and so forth. So that's sort of the legal sort of overview. David, I wonder if here you could take about 2 minutes to talk about employees and how does this sort of situation sort of overlap or interplay with corporations having employees?
Sure, thanks, Rod. So on this, I think the first question that you're asking is really who are we dealing with? Is the person an employee of the corporation is the first question. Are they an employee of management? Then the questions are then about management's role. And I know a lot of questions are coming up now about, okay, employees call in sick. What are the obligations there? You know, employees call in, they have to take care of a family member. One really interesting extension of the Employment Standards Act that happened recently was the provincial Ontario government put out a new directive that they're going to be amending retroactively to the end of January, the Employment Standards Act, to cover more reasons for which someone can be take a leave from their employment. So, for example, someone who needs to be home in quarantine if they are sick, if they need to be home to take care of someone who's sick, if they need to be home even for to take care of children and for childcare, that daycare is not available now. The question is, if someone comes to you and says, whether it's one of the employees, specifically the corporation, and says, okay, I can't be here anymore, the automatic response is not necessarily, oh, you need to be here, you have an employment contract with us. It's really to try and figure out, be it with legal counsel or any other advisor, what role that person actually is playing in the corporation, and can they be accommodated in any way? And if not, I mean, what type of reason are they coming to you with to seek leave from their employment? So if they're coming to you and they just say, oh, I have a general fear of COVID-19, it's coming for me, that's not probably enough for them to just be able to go home, despite the requests of government now for everyone to self-isolate until this changes, until, you know, there's the Emergencies Act, for example, is invoked, or if there's other sorts of requirements from government. Just saying I have a general fear of getting this disease is likely not enough. But if they do fall into one of those categories, either under the Occupational Health and Safety Act or under the Employment Standards Act that's now been extended, you might want to address each specific situation with council to try and figure out, okay, how can we accommodate, can we fill gaps, what types of leave are available, if they need to be off for a long period of time, could we lay them off so that they're eligible for EI? A lot of this will depend upon your contract with them as well, what type of stipulations are in the contract for sick leave and other such programs. So this is a topic all on its own, so I'm going to throw it back to Rod on that, unless any follow-up questions.
So, thank you, David. And I would add this maybe, is that in the meantime, so while in and of itself, the general fear of the coronavirus would not, generally speaking, be sufficient for an employee to say, I'm not going to go to work, an obligation that the employer would have is to put in place precautions and measures to ensure as much as possible the reasonable safety of this employee. And you do this by providing training. You do this by providing masks if required, gloves if required. You do this by telling your owners not to go necessarily and engage face-to-face the super or the concierge. You can put in place precautions that will minimize the risk to the employee, and by creating a safer environment, then you reassure this employee, and it's more difficult for the employee to well, I guess it's easier for the employee to want to continue and assist you and help you. Okay, so let's move on because we're running out of time. I'd like to move on to the next, the kind of precautions. Graham, if you can, maybe I'm going to bring back the slides now. If you can sort of talk about the kind of precautions that we have seen corporations take so far. Let me see if I remember how to do this. I'll do this, and I'll put the slides back on. Okay, Graham.
So what we're seeing in terms of the responses we've got are that the main steps that have been taken, most popular was that the cleaning that's been taking place of common areas has been taken up a notch. Signs have been posted warning residents and occupants about what's going on. Similarly, notices have gone out to owners. What we're also seeing is, events in party rooms or certain amenities, like you were saying, the gym earlier, are being closed. And in some corporations, we're seeing hand sanitizer stations being set up.
Right. And so the fact that you see these, I mean, this shows you what some have done. It doesn't necessarily mean that you have to do it.
No.
But this is a good picture of what has been done out there. And what about hand sanitizer? Can you tell us a bit more about that, Graham?
Well, in terms of hand sanitizer, we know at least 43% of our respondents either had it before or have it now. An additional almost 13% are planning on getting it. So, I mean, in terms of general trends, taking this data for what it is that hand sanitizer seems to be either in place or planned to be in place in over half of condos. Obviously, one issue that is going to be presenting itself, and this is actually something that I'm seeing in the chat that somebody's brought up, is that hand sanitizer is a hot commodity right now, and due to hoarding and looting behavior that you can sometimes see, it can either be hard to get your hands on, or once you have it, somebody with sticky fingers might just take the whole thing. And, in terms of what you can do about that, it's the same risk you run with anything in the common elements. You have to rely on your security systems as best you can, and hope that owners and occupants will, band together to work through the crisis without behavior like that. But that is definitely a practical issue that might be faced.
Okay, thanks so much. And now on to the management section of the agenda. And I'm going to start with you, Catherine. I'm going to give you a couple of minutes maybe to talk about the level of service, how this crisis is affecting the level of service that is provided to owners.
I apologize that I'm not coming through. Please let me know. We'll cut off video.
Catherine.
Audio. I think one of the key things. One of the key things that
there
we
you
have.
Go.
Can you hear me all right?
Yeah.
And I'm sorry, I've closed the video just to make sure that you can hear me well. I believe a number of the condominium corporations have, at this point in time, moved to delivering services under a different model. And by that, I mean their manager working remotely, closing things like the amenities to residents. And that is, of course, in service of ensuring that they can keep the common elements clean and sanitized on a very regular basis. Closing the amenities, as Rod had mentioned earlier, is also in service of ensuring that residents can observe the social distancing practices that have been recommended by public health organizations. What I do think the next steps are and how we continue forward, given, as David had mentioned, the fact that we will have fewer employees as time goes on, either because of self-isolating behaviors or frankly because they're staying at home to care for children who aren't in school, is a reduced staffing load. So if managers and their boards haven't already been talking about what their priorities are in a community and how best they can service those needs, I think those are next step considerations. I know all of the managers that I work with, and by extension managers that I communicate with on a fairly regular basis through ACMO, are also trying to accommodate as best they can folks who have let the management office know that they are self-isolating, and for a variety of reasons. And that's on compassionate grounds, so that they can stay home and stay safe. And the whole intention of everybody staying home and staying healthy is to prevent the transmission within the community and to also ensure that the healthcare system can service the needs of the people who are sick and very sick. One of the biggest gifts you can give your community as a property manager is to communicate often and to give folks a sense of power. So that comment, I think it was Tanya who mentioned finding hand sanitizer these days is difficult. It comes from a place of the people in our community trying to find normal, trying to find a sense of control. And we can help them by communicating forward, one, how great the community is, how people are looking out for one another, and how people are taking seriously the advice of healthcare professionals in order to make sure that the community stays safe.
One of the questions that came up, Catherine, I'm going to put you on the spot here, is what about accessing units? Are managers still required to access unit? And so twofold, managers accessing the units and maybe contractors accessing the unit. Maybe somebody has an ongoing renovation project. How do you tackle that on right now?
It is a source of discussion amongst communities that I'm aware of, whether they ask their residents to stop in-suite renovations, and that's to try and lessen the burden of visitors coming to the community. It might be something that those condominium corporations decide to do on a going forward basis. If someone is self-isolating, I would recommend that, barring an emergency, flood, fire, risk of human life, there is no need to enter into the unit and to put staff members or others into peril of any kind. If you are still doing things like routine maintenance in the suites, irrespective of whether someone is or is not reported to have self-isolated, do make sure you are observing what is called by the World Health Organization and other public health groups universal protections. And that's, of course, lots of hand washing before and after. Sometimes things like disposable gloves and footies can be helpful. And of course, social distancing. So you're looking to give the contractor, the escort, and the suite owner a lot of space in the suite so that you're more than a meter away. Again, if you look practically at the size of the units you're entering into, I think this also gives you some good guidance as to whether or not that's something that can or needs to be done right now. As property managers, what you're balancing are the risks to damage to units and to the common elements. So for instance, if you have a sink backup, it's not something that can wait for a couple of weeks. It's something that's going to need to be attended to. But if it is something that can be put off, it's not an active water leakage, perhaps you have that discussion about scheduling it for another time.
Wonderful, thanks so much. Something else that came up in the questions that are popping in is if you have a volunteer program where you sort of encourage some owners to help other owners that have needs and so on and so forth. And I know what we've recommended is if you're going to go that way, you want to make sure that you sort of provide enough information for people to make a decision as to whether or not and to what extent they want to participate. It needs to be very clear. that those volunteers, would also need to put in place a heightened level of hygiene and avoid going into units unless it's required. So, I mean, people want to help, but you want to make sure that they don't put themselves at arm's length. I'm going to move on to Sandy now. And Sandy, maybe you can talk about social distancing and hygiene and how managers are tackling that. Because, I mean, there's a lot of people coming in and out of condos. There's a lot of meetings that need to take place. So, Sandy, what kind of guidance can you give us?
Sure. Before I get into the hygiene and social distancing, I do want to reiterate the points made by the attorneys. As boards, it is critical to remember that you are the body empowered to make decisions for the community. To assist you in the role, WB and our parent company hosted a webinar last week and are participating today to help you establish a framework to make those critical decisions. If there is at any time that boards should be relying on professional counsel and local health authorities to guide their processes, it is now. Personal hygiene is being stressed over and over again throughout every media report we hear. And this is exceptionally important in our high density condos. Residents have a personal responsibility to take preventative actions. With hundreds of residents touching doorknobs and elevator buttons consistently throughout the day, it is not realistic to expect cleaners to have every surface perfectly sanitized all day long. We cannot stress how important it is for condo residents to diligently wash their hands and/or use hand sanitizer and avoid touching your face after touching any surface. Many condos have already set up permanent sanitizing stations throughout the high traffic areas of your buildings, and that's great. If you haven't done so, it's highly unlikely that you'll be able to find any at this time. But I would hope that supplies will start to become available again in the very near future. If you have them, ensure that they are placed in the high traffic areas, inside your entrance doors, at the elevators, on the main floor, garage levels, and any other areas that you feel are important in your specific buildings. Managers and boards do need to work together closely with your cleaners to ensure you're getting as much extra cleaning of high traffic areas as possible. This is why it is so important to close your extra amenities such as party rooms, pools, hot tubs, saunas, change rooms, gyms, game rooms, barbecue areas, guest suites, and any others that are in your buildings. Owners may want these amenities to stay open so that they have something to do during these next few weeks of possible isolation. But as board members, you need to act responsibly to protect the health and welfare of all of your residents by closing these facilities. Social activities scheduled should be postponed in accordance with government requirements for numbers currently permitted to congregate. However, this number is decreasing daily, so jump ahead of the curve and simply postpone gatherings for now. It is for the health and safety of your residents, and in many cases, the larger elderly population of your buildings. A very serious concern we are also discussing now with our managers is a plan B for your cleaners and supers. What happens if they are quarantined or become sick and are not able to work? It will depend on each building's circumstances, but please start thinking about it and preparing for it. We would much rather you're prepared for these contingencies than scrambling at the last minute. Today, we've actually heard of one of our buildings that board members were actually helping out with the daily cleaning because their cleaner, who is a direct employee and their only employee, has respiratory concerns and can no longer work for fear of catching COVID-19 from the many snowbirds who are now quickly returning to the building and are in self-isolation. Deliveries is another concern for both high-rise and low-rise buildings. We expect there'll be far more food deliveries now as restaurants are closing down. But please don't expect your security staff to be the ones that to deliver these around your buildings. It's not their job. If the recipient is healthy, they should be required to come down, get their food, get their deliveries. If they are not, consider the food delivery person going up to the door and leaving it in the hall outside of the unit entrance, not having contact with the person involved. Owners should also consider minimizing unnecessary deliveries and non-essential visitors to your units at this time. Social distancing is a new concept to us all, but it really is now our reality. Please make sure that any guests have no symptoms and have not traveled recently. These are exceptional circumstances that are requiring exceptional measures to be taken by all levels of government, including our condo boards. Thank you.
Okay, thanks so much for that, Sandy. One of the questions that came up is whether small condo corps are held to the same standard as bigger condo corps. It's going to be a case by case, and you're going to have to balance all sorts of sort of competing resources and interests. Obviously, look at the density of your condo. If it's a spread sort of townhome complex, there's the risk it would be perhaps lesser, and the requirement to enter units and to commute over common elements would not exist. So you have very, very different sort of situation when you're looking at townhomes versus if you're looking at a 500 unit tower downtown Toronto. Also look at geographically where you're located. You have to put that into the equation. I mean, don't be overly confident that the fact that there hasn't been the case in North Bay doesn't mean that nobody's affected and nobody has traveled to or from North Bay. And I'm sorry if I'm using that example. It's the first city that came to mind. But so you have to put all of that into the equation. And ultimately, the question will be whether or not these directors have acted reasonably, have acted in line with what other reasonable directors would have done. So your level, what's required of you will vary tremendously depending on your own situation. I'm going to turn the microphone again to Catherine, if I may, and I'd like Catherine to, maybe you can talk you've raised the importance of communication, and maybe you can elaborate a bit on that. And specifically maybe the kind of communications or the setup you should put in place to communicate with directors in these very stressful times.
I think there are probably three main communications pieces that managers are undertaking currently. One of them is amongst managers and their staff. The second is amongst managers and the boards at the individual condominium corporations where they work. And as Sandy so rightly pointed out, who are the ones who are going to make the decisions, tough ones, admittedly, for each of their communities. And then the third is for the residents. Again, these are fast-moving items, fast-moving restrictions, and changes are happening all of the time. By now, I'm hoping that everybody has communicated some of the universal precautions, some of the differences in terms of how they are affecting service. I believe for most, if not all management companies, we're moving to not have foot traffic to try to prevent some foot traffic at our concierge desks as well, and to protect our staff members in that way, and to hold meetings electronically where they need to happen, and as Sandy referenced earlier, to postpone or defer meetings until after the current social distancing measures have been waived by public health administrations. The final piece of communications is, of course, to residents so they know what to expect in terms of what is open and what is closed and what that timeline might be like. As Rod has mentioned, it might be to understand or try to facilitate some buddying up of suites with an elderly neighbor, for instance, or something like that. If we can affect those connections between people, we might try to do that. I think that would be really helpful. And the third piece with residents that I think is really important is to set up or establish a bit of a routine in communications. We've all talked about the fact that these are unusual, uncertain, uncharted waters that we're in, and committing to a regular cycle, I think, helps folks understand that we're taking in questions, we're processing how best to apply them to our individual communities, and then we'll commit to getting back to you. And whether that's daily when things are changing really quickly or weekly as time progresses, I think people are amazing. They can deal with an awful lot when they know what to expect. And so if you commit to and are diligent about maintaining this good, constant stream of communications, it will be really appreciated by your homeowners.
Wonderful, thanks so much. One of the questions that came up online following Sandy's intervention was whether condo corps could prohibit owners from receiving visitors. Because the suggestion was that, and I think Sandy's suggestion was that each owner is responsible to take all precautions to ensure that they don't get infected. But at this stage, and I think this is clear, at this stage, a corporation cannot prevent owners from receiving visitors, cannot prevent a snowbird from returning home, cannot prevent a delivery from taking place for now. I mean, if things evolve, we'll have a chat later on. But so the suggestion was not that the corporation will start policing whether Unit 306 is entitled to receive, their in-laws, or is entitled to receive the nurse that's taking care of them. We're not at that stage yet, and we don't have the jurisdiction or the authority to prevent that at this stage. And I think this is a good sort of segue to you, Jason. And you may be able to elaborate a bit on what I just said. And I mean, if you disagree with what I said, you gotta be loud and clear. I'm okay with that. But if you could talk about that, but also if you could talk about, there's one group of people we haven't talked about communicating with, and those are the contractors. I mean, the corporation, we have all sorts of contractors. We have people that come in to deal with all sorts of services that we're required, like maintenance and so on. And so, I mean, how do we ensure that these people continue to return? What kind of communications do we have with them, Jason?
Yeah, absolutely. I mean, your contractors really support your operations, and they're an extension of your operations. I mean, we focus quite often on the superintendent, the concierge, the security staff, administrative staff. But I think it's important that, number one, we as the property manager of the board send a communication to our top 3 or 4 service providers and say, number one, we rely on your services. Number 2, you're aware of the current concerns going on in the community. Number 3, you're not sending anybody that has been under travel restrictions or is under self-quarantine for the reasons underneath what's been posted on public health websites. I would caution anybody from kind of regurgitating them in their communication versus suggesting that your trades meet those requirements, and those are the only trades and service providers that are permitted on your property. You are well within your right to do that within that reminder. But I think it's also important to understand that you have a requirement to engage those trades because they quite often help you with your building operations. For example, every 30 days you have fire code requirements that your staff just simply can't meet. So your service provider has to, kind of come every 28 days to your building and complete some fire code requirements. And you want to make sure you're engaging them to say, hey, listen, make sure you're taking precautions so that you can continue to service my building, and make sure you're not sending anybody who's in contravention of the public health guidelines. I think that's very key. And you also get that in writing and document that that's another step that corporations are doing to keep their communities running and keep their communities safe.
Yeah, and I think I'll just jump in one thing that corporations should probably be aware of with respect to tradespeople and any contractors they have. We are in times now, as everybody has said, where people aren't necessarily showing up to work, and corporations may be running into issues of contractors who are either planned to start a renovation or a project or are in the midst of one, may feel that they can no longer send anyone there. And in terms of how to respond to that, it's going to very much depend on what the terms of your corporation's agreement with these contractors are. But it's important, I think, for corporations to be aware that we may well be in a time where something called force majeure clauses have been invoked. And those are something that find their way into a lot of contracts that typically say, in events of a mass destruction or, an act of terror or a big disaster, that can be an out to get out of the contract. And, I think the kind of hot word tonight has been that we are in unprecedented times. So how this will shake out, we're not entirely sure, but it's worth noting that we may very well be in a time where those clauses can be relied on.
Okay.
If I can add just one more thought there. I think what we need to do is be rational and considerate as well of attending to the most important of priorities. I'm really glad, Jason, that you mentioned in particular requirements under the fire code. Health and safety and compliance with the fire code are going to be some of our biggest priorities. And sometimes in condo land, we can forget about those priorities, right? The physical security of the building, the physical safety of people, because we were very concerned about accessories. And I want to make sure, because I'm speaking to so many board members currently, that remains fore of mind. And as much as we want all of our contractors to live up to all of the terms that we would on a regular day, there are also some contracts that we may have that as corporations, we might want to look at the terms, and we might want to speak with our contractors about stopping that work during this time. So I do believe there will be a lot of discussion, a lot of negotiation, but the things that can't be sacrificed are fire and life safety and security of the building as a whole.
Graham, can you maybe tackle the question of quarantine and who can enforce it? Because I keep seeing it come up on the chat channel. And I guess ultimately the point blank question to you would be, can the corporation enforce self-quarantine, or is it even its job to do that? And similarly, can management or should management police self-quarantine? So we have, let's say, the snowbird that came back home and he's checking his mailbox. His or her mailbox. So a question that keeps coming up is, to what extent can we go and enforce that? Can you just maybe tackle this?
Yeah, and the answer is an unequivocal that no, that boards or management do not have the authority to impose quarantine on people. We are, as has been said, we're simply not at that stage yet where even the government has enacted powers to impose quarantine like that. So at this stage, what corporations can do are take steps like putting out hand sanitizers where available, or closing certain amenities like the gym, that are places that kind of by necessity involve touching the same things that people before you have already touched. And putting out notices, putting the onus on owners to take some responsibility and do what they can to all work together and try to contain the spread of the virus. But at this time, the answer is an unequivocal no. Corporations nor management can impose a quarantine on someone.
Right, and sometimes people mean well. I mean, there's a snowbird that came back home at my condo recently, and he said, I'm going to go to the gym at 5 in the morning when nobody's there, just to make sure that I minimize risk of, being in contact with people. Well, no, that wasn't the proper answer. And in fact, the easy way to deal with that is to close the fitness room. And that's what took place. We closed the fitness room. So, this person won't be there at 5 or at 4 or at 6. Jason, I'll get back to you in a minute, because a question that keeps coming up, and I mean, hindsight is 2020, but one of the questions that comes up is, how do we prepare for that? And how do we, what kind of precautions can be implemented now, despite the fact that we don't know what's around the corner? Can you help us with this a bit? The kind of plans that should be in place, like I'm talking safety and security requirements. How do we ensure that we maintain that?
Yeah, absolutely. So as an example, right now, property managers are tasked with their teams in complying with, right now, Ontario Fire Code requirements on both a daily, weekly, and monthly requirement. Every day, I have to have a documented check that my sprinkler room's been checked. Every day, I should have a documented check that my fire alarm system's functioning as required. Those are 2 daily fire code requirements in almost every condominium in Ontario. So what I suggest that we start planning for is, what are our core critical things that we are checking on a daily basis? So as an example, what's my critical infrastructure? I want to make sure my generator is powered in the auto position and ready to respond kind of every day. I want to make sure that my fire alarm system's functioning, and I've checked that sprinkler system every day. I want to make sure my CCTV system is recording. So those kind of daily checks are things that we should start amalgamating right now, if you haven't done it already, and then look at cross-training your superintendent if you have a live-in superintendent. For the simple reason is, there is going to be a time where your 4 concierge or 4 security guards that operate on a daily basis are not going to show up. Whether they're not showing up for no matter what the reason is, whether it's because they can't get to work, or they are ill, or the entire concierge team has fallen ill, there is a time where you're going to be at 0 manpower, and the condo corporation is going to have to make some tough decisions on, I have no staff, but there are 2 or 3 things that I should be doing every 24 hours to make sure the integrity of the building is maintained.
Okay, wonderful. Thanks so much. Now I'm going to go back to you, Denise, for another short sort of legal chapter here. corporations, one of the things they do is they have meetings. There's board meetings that need to go on. There's decisions that need to be taken. And then there's AGMs, owners meetings. And so maybe I'm going to start with asking you, Denise, if you can shed some guidance, help us shed some light on AGMs and whether or not we have to cancel them. Do we hold them? If we hold them, what precautions should we take? Where do we stand today? Because this is changing by the minute.
Yeah, you're right. It's changing by the minute. So last week, if anyone read some of our blogs that we did, our position was very different than it is today. So we had the government mandating limiting the gatherings to 250, and now we've got 50. And I suspect that we may see a change where we get down to 10 or fewer. So with this in mind, we are recommending that corporations postpone their AGMs. I mean, definitely for March and possibly into April, and just see how it goes. I think what the question that I'm hearing all the time in the past since this all started was, what do we do about the 6-month requirement to have our AGM within the fiscal year end? And I think most of us are agreeing that we've got this overriding concern about the safety of the residents. If that's the case, that there's good reason to postpone the AGM. And so I don't think that's an issue, but I think that it's time that corporations consider postponing their AGMs. Another question that I'm getting is, well, if we do postpone our AGM, what is the requirement for notice and preliminary notice? Do we have to start the process again? The answer is yes. You have to start sending out your preliminary notice and asking for candidates. I also want to make this clear that it's not just annual meetings, but they're bylaw meetings. There are also turnover meetings. And turnover meetings require that they be held within a certain period of time. My same comments apply to turnover meetings. We're dealing with the safety of residents. So I'm not too worried about the timelines under the Act. Now, there's been a discussion about electronic voting. So some corporations have the ability to do electronic voting, but not all do. And there are a few condominiums, and I know I've been involved with a few, that are continuing to do their meeting through electronic voting. The issue there is that electronic voting is just voting. It's not having an online meeting. So under the Condominium Act, you still require a place to hold the meeting. I spoke to a client today, was thinking of a creative way of doing that, sending out a notice of meeting, saying that it's at the in the common area amenity room, but nobody is to show up. For your own safety, don't show up to the meeting. You could vote electronically. You can vote by proxy, and I'll talk about that in a minute, but don't show up to the meeting. And what we'll do is we'll do a Skype or kind of a Zoom meeting or something similar to what we're doing today. It's not an official meeting because the Condo Act doesn't allow us to do this, but it's a way we're communicating, and then we can do electronic voting. So people are trying to be creative. My concern about that is, first of all, if you have proxies, you have a proxy holder that's appointed, and where does that proxy holder? The proxy holder has to show up to the meeting. It's a little bit complicated. It can be done, but again, our recommendation is, unless this is an urgent meeting for some reason, having the meeting and doing it in this sort of creative way especially if there's some controversial, contentious issue, may not be a good idea to do. Because what you don't want is 6 months from now, some owners to challenge the validity of the vote that took place. I think what we need to do is corporations need to look at this in the future as a way of moving forward with their meetings. But as of now, what we're recommending is postpone your meetings. You may want to just wait till April to see how things are before postponing those.
Okay, thanks so much. I would add something to what you said, Denise. I think it is possible to hold a meeting on paper or by proxy or electronically. And that sometimes happens when, think of a case where you're voting on a bylaw, you didn't get the quorum at the meeting, then some proxies come in later on, and then you sort of recall the meeting, but really in the room, you only have the proxy holder and whoever's counting the votes, right? And so I think it's possible to hold an AGM remotely, provided that somewhere the meeting is taking place, be it by proxy or whatnot. Now, having said that, what's crucially important, I think, is to convey to the owners what's happening and why it's taking place the way it is, because owners may actually think that you're just about to take over the world, that this is what's happening here behind closed doors, and that's truly not what's happening. And you may want to reduce that meeting to what is essential. Thanks for this, Denise, because that was the heavy lifting. With respect to board meeting, it's a lot simpler. It's a lot easier. I mean, under the Act presently, you can hold a board meeting remotely, be it by phone, be it by Skype. It's got to be in such a way where people can interact live. So it can't really be just by email, but you could do it by Skype, you could do it by teleconference, you could do it by phone, you could do it with FaceTime. Now, the trick is this, though. Every director has to agree. And so there's a bit of a question as to what happens if one of the directors does not agree. So you don't need a bylaw, by the way. You no longer need to have a bylaw to be able to hold board meetings electronically, but everybody has to consent. So the question may be, what do you do if one or two don't consent? And I mean, these are unprecedented times. And I would say that if a director was to be obstructionist and was to block these meetings from proceeding for no good reason, when every other sign points towards we need to have a meeting and we need to do it electronically, I would question whether this director is actually acting in good faith and whether that director is actually meeting their obligations under the Condo Act to act diligently, honestly, in good faith, and so on and so forth. So I really urge directors to be flexible and to be more open to allow business to continue without putting people in arm's length. And very quickly, because we're running out of time, Denise, is, well, actually we're entirely out of time, is what do we do with a requisition meeting? How do we handle that? Because there's no penalty if you don't hold the AGM within the 6 months, but there are clear consequences if you don't call and hold a requisition meeting within the 35 days.
Yeah, and I also want to mention, I don't think now's the time for corporations to start passing rules. Because as soon as you start circulating the rules, you're giving owners the opportunity to have a requisition, and then you're just posing all those issues. So I think what the board should do once they get the requisition, and assuming it's valid, so that's the first thing, notify the requisitionists that as a result of the coronavirus and the safety concerns of the residents, the board intends to call the meeting. We will call it as soon as we are able to. And so what you want to do is avoid that situation where the owners are going to say you're failing to call it, so we will call it. I think if you send out that notice, I think that's a reasonable position to take, and the board will still maintain control over that requisition meeting. Of course, you could try to get consent. If you get consent to the requisitionist, that solves your problem.
Okay, very good. So we're pretty much out of time, and I'm sure that there's tons more questions out there. We tried to answer some of them as they popped up live on the chat channel. We've also had a look at we've received nearly 100 questions from you folks before the meeting, and we tried our best to address them. But I mean, within an hour, it's nearly impossible to solve every problem, especially in such a fluid situation. But what we do propose is we're going to meet again next week, same time, same channel, same people, and again we'll offer two different sort of time frames for the early birds and the later birds, because otherwise we risk overloading our channel, and so we're going to have maybe another opportunity to speak again and to present more information and to address either more changes in the situation or more questions that you may have that you may want to send our way. At the end of the day, though, as useful as I hope you found this presentation to be, it is crucially important that you rely on your advisor ask questions, call your lawyer if it's a lawyer that you need assistance from, call your security advisor, call your property managers, and try to get some real-time information, because the situation is evolving. Now, what I've done here, and let me see if I can do this while I speak, I can't do two things at once, is what we have done is we've added a tab on, we've added a tab to the Condo Advisors website. Let me bring you there. At the very top right corner, you will see that we've added a tab that says, it's called Webinar. And so this is where you're going to find information about our next webinar. You can go there to Condo Advisor, click on this, and if you do, it's going to bring you to the next webinar, which is already sort of tentatively scheduled. You'll see the topics that we want to cover, and it also allows you to register if you want to be part, if you want to listen in again. You need to register again because we're going to send you another logging sort of a code or a link. And so if you want to be part of the discussion next week, please feel free to go and click on the webinar. And if you have any questions that you want to send our way, everybody around the table is more than willing to try to sort of answer any questions.
And I'll just say too, in the meantime, I've been watching the questions as they've come into the chat. We haven't, like Rod said, been able to answer all of them, but these are all written down and tracked. So we'll get to them next week or the week after, or whenever time permits.
Okay, last round the table maybe. Denise, parting words of wisdom?
Well, we don't know all the answers. So when you're asking us for opinions, just like what I said today, you're going to find others that may take a different position. This is all new to us, so we're just doing the best we can based on our experience.
Thanks so much. Jason, let me unmute you. Any parting words?
Yeah, listen, I put myself in the position of a resident in any high-rise building or condominium. I want to know throughout all this that the building's going to continue to have the high standard of code compliance and safety and security, and I'm above all going to be safe in my home. I would finally address, I've seen a couple of questions regarding assembling a volunteer group to work in the high-rises. It does represent some concerns. If it's done through a board member or through the corporation, you can accept some liability by running that volunteer group. And it's been done on several times through the emergency management community. In fact, emergency management communities have gotten trouble with running volunteer groups. So just be careful. If they're spontaneous within your building, fantastic. But if it's run through the corporation, be careful.
Okay, and Sandy.
I'm just going to reiterate what I said earlier. Everyone needs to exercise great hygiene now. If you never did before, wash your hands constantly. Every time you touch anything, have sanitizer for women in your purses, and just keep very careful with social distancing.
Okay, Catherine, anything to add? I think we may have lost her. I need to unmute you. Go ahead, Catherine.
Thank you. Keep calm and carry on, and especially managers and your phones. It's our link to everything we use all day long.
Yeah, I had to mute you, Catherine. I'm sorry, but you're not coming through clearly right now. I'm sorry about that. Some technical difficulties, and hopefully we can fix that before the next presentation. So thank you everybody that joined in. I see that many of you hung around until the end. Thank you so very much. Be safe, be happy, and maybe we'll talk next week. Thanks so much, everybody. Good night.